So my name is Josh Rubin. I'm with the University of Michigan Department of Learning Health Sciences at the University of Michigan Medical School, and I'm also actively involved in the learning health community. Everything I'm doing is focused in one way or the other on realizing this vision and helping it to continue to evolve and improve as a sort of a collaborative, emergent system over time. I have really two different roles. One is my work at the University of Michigan with Dr. Charles Friedman, who you'll end up talking to soon for this project. What we do here is, the University of Michigan, the medical school here, has created what we believe is the first in the United States Department of Learning Health Sciences. It's a department in a medical school that's devoted entirely to learning in healthcare and in health at every level of scale. Learning at an individual level, learning at organizational levels, and learning sort of at large system levels. My focus is on the system levels, on the large-scale learning initiatives here, which is the kind of work that's eventually going to give rise to the learning health system vision. The other thing that I do in my not so copious free time is, and Dr. Friedman's also very involved in this, is this group called the Learning Health Community, which has really emerged as a grassroots movement among a bunch of very passionate stakeholders who have all put so much of their own time and resources and effort into this idea of trying to build a 1.0, so to speak, learning health system in this country, realizing it by all working together. So I think over the past few years, it's gone from something that, I don't know if I would say 5, 8 years ago, the Institute of Medicine was doing great reports about it and thinking about it. My former employer, Joe Kanter, who is turning 92 this year, and he started the Joseph H. Kanter Family Foundation, which is the only private philanthropic foundation aimed at realizing this learning health system vision. So 5, 8 years ago, it was really viewed as something that was a wonderful theoretical idea, but it was just a lot of people, with few exceptions, thought it was very hard to make happen. So all the reasons it couldn't be done. I think learning health system fever is catching on in this country and overseas, and people are really starting to say it can be done, and it really must be done. We can't afford not to do it. We can't afford not to learn from the health experiences of 90-something% of all people plus, over time. We can't afford not to share the data. We can't afford not to have the knowledge pushed. We can't afford to wait 17 years for things to go for knowledge to go from bench to bedside. I think now there's a lot of push behind it in terms of federal policy, and the Office of the National Coordinator declaring that it is the overarching goal for the next 10 years, achieving a learning health system, and everything else sort of feeds into making that possible. There's been a number of publications about it, some of which I've been lucky enough to be involved in writing, but some others which have come out not in health IT or health system type of thing, but in more mainstream medical journals. And even learning from data is getting attention in the New York Times and in absolute mainstream media publications. And there's a lot of learning islands that are developing, individual provider health organizations that are learning from their data. And then there's sort of small to medium-size, different-sized networks, even larger networks that are emerging. So where this is going is, I think in the next few years, I think one is hopefully the community that's involved, or the communities that are forming the sort of grassroots movement continues to grow and thrive and push forward key initiatives that'll make pieces of this puzzle happen, get all the right kinds of stakeholders and thought leaders and doers together around, say, governance for the whole thing and standards for it, and get the buy-in from all the right folks that we need. The networks that are emerging continue to grow. People keep trying new things, but there's also a recognition that there's a need to work together. That as some of the pieces of this puzzle get more obvious, that the next organization or next network trying to do this doesn't have to build every piece themselves. Some of it already exists. Just like 10 years ago, there were a lot of devices. Let's say you wanted a portable GPS that would needed its own battery, needed its own charger, needed its own screen, needed an operating system, needed things like that. And then suddenly smartphones took off, and a smartphone had a lot of these pieces in one place. So now you don't necessarily have to develop all those pieces. You develop an app that lets that combination of things do something creative. Hopefully, some of the pieces of the learning health system or the core ingredients of the kit get put into place, and then real innovators can take off building the next building on top of that. And as that gets enabled, that will spur sort of a revolution in this. Keeping in mind that this is an area where there's a real, I guess I call it an economy of scale, economy of scope. That there's value you can derive from sharing longitudinal health experiences from, let's say, 100 million people that with privacy protected that you might never get from 10 million. So you really start to need the whole country or multiple countries to work together to share this data. And there's an economy, and you got to get the knowledge where it needs to go, knowledge of what the best practice is for a disease that's spreading has to get to where that is. So hopefully there's a spirit of working together on some of this and some of the right incentives to make that happen too.